A person with testicular cancer has just been handed a very unexpected and frightening diagnosis.
While it's uncommon, it is also an absolutely curable disease in the vast majority of patients.
Testicular cancer commonly affects young men who, after treatment, may survive 40 or 50 years. And if they have a side effect from treatment, that's going to follow them for all that time. At Mayo Clinic, our goal is, number one, to give the very best possible chance of cure, and number two, to do that with the least possible burden of therapy, risks, and discomfort for the patient.
We have frequent meetings with our colleagues in medical oncology, urology, radiology, and other specialties to review complex testicular cancer cases and make sure that we can evaluate them on an individual basis and come up with a unique treatment plan that's ideally suited for each individual patient.
Treatment may be as simple as removing the affected testicle and simple observation. For other patients, additional treatments, in some cases chemotherapy, in some cases radiotherapy, and in some cases additional surgical procedures are necessary to accomplish that cure.
When radiation therapy is recommended for these patients, proton beam therapy is an outstanding tool that allows us to very specifically target the cancer cells while minimizing radiation exposure to nearby normal tissues and thus decreasing the risk of long-term complications in these patients.
In many cases, after that initial conversation about the best approach for your testicular cancer, it would involve us working with your care team at home to assure that you can simply follow the regimen that we would recommend while you're at home. Since the expectation is that most people will be cured, we need to think about long-term impact of treatment, including things like fertility and body image. So if a patient is going to have a consult and may wind up losing a testicle as part of their therapy, we like them to always bring up with their physicians issues around possible sperm banking if they're interested, and things like, do I want a testicular prosthesis or not, regarding body image issues.
Here at Mayo Clinic, we really have all the tools available to treat testicular cancer in its various forms.
Picking a center of excellence like Mayo Clinic is your best bet to help get the best outcomes possible.